Pursuit of the 3 C's: confident, concise, and consistent provider recommendations for adolescent vaccines, featuring healthcare visits at ages 16 and 18. This video is brought to you by Unity Consortium, a nonprofit organization with a mission to provide action-oriented leadership, innovation, and education on immunization and preventive healthcare for adolescents and young adults, and was developed in collaboration with the University of Colorado School of Medicine Behavioral Health and Wellness Program and Indiana University School of Medicine, Division of Adolescent Medicine. This video series demonstrates common discussions about adolescent vaccines with families, featuring healthcare visits with teens who are 16 and 18 years old. First, you will learn how to balance the standard presumptive recommendation for the meningococcal ACWY or MEN ACWY vaccine and a shared clinical decision-making recommendation for meningococcal B or MEN B vaccine in vaccination conversations. The recommendation and information is shared in a confident, concise, and consistent manner with both the parent and the adolescent involved in the decision-making process. Second, you will learn about the types of questions commonly expressed by parents about the meningitis vaccines and how to view these questions as a normal part of the vaccination conversation. Finally, you will be shown some simple motivational interviewing, or MI interventions, that can help parents and adolescents move from being hesitant about a vaccination to a position of acceptance. Motivational interviewing is a guiding style of communication that elicits an individual's own motivation for behavior change. For a refresher on the presumptive recommendation and motivational interviewing for hesitant parents, please view our Pursuit of the 3 C's: confident, concise, and consistent healthcare provider recommendations for adolescent vaccines video at www.unityforteenvax.org. You will see in each of the following scenarios that the provider follows the 3 C's approach by being confident, concise, and consistent while making the vaccine recommendations and in answering questions. In the first scenario, 16-year-old Josh presents for a well visit with his mother, Mrs. Mitchell. Watch as the healthcare provider recommends and the parent accepts the MEN ACWY and MEN B vaccines.
Hi, Josh. Nice to see you again. Mrs. Mitchell?
Hey.
Good to see you too.
So, Josh, how's your driving coming along?
It's pretty good. I've had my license for about 6 months now. I even drove Mom here today.
He's really doing well and getting in a lot of practice.
Well, I'm glad to hear it. Today, we're scheduled for a well visit. Let's start with talking about vaccines. We'll give Josh the booster dose of the meningitis vaccine that protects against 4 types of the bacteria that causes meningitis. He received the first dose of this vaccine when he was 11. There's also another type of the meningitis vaccine, meningococcal B, that I'd like to discuss with you today. Is that okay?
We expected the second meningitis shot today, but I wasn't aware that he'd need another meningitis vaccine on top of that.
Well, you already know that meningitis is a serious brain infection that, although uncommon, can progress rapidly and can lead to death and other serious long-term health problems. The vaccine that Josh has already received protects against 4 types of the meningitis bacteria, and he'll be getting the booster today. Now, the MEN B vaccine, which requires 2 doses, protects against an additional type of the meningitis bacteria that is actually the cause of most meningitis outbreaks in the U.S. today. Most cases occur between the ages of 16 and 23. And while it's somewhat rare, college students are at an increased risk for MEN B disease. What questions, if any, do you have about the MEN B vaccine?
Is this a new vaccine? Are there any side effects?
Those are great questions. Actually, vaccines for MEN B have been used in the U.S. since 2014. And as with most vaccines, the most common side effects don't last very long and are typically mild. They include soreness and swelling where the shot is given, tiredness, headache and muscle aches or pain. Now, more than half of the adolescents will experience one or more of these, and less often, some people have had some nausea. Now, these usually go away within a few days.
What do you think, Josh?
Well, if you two are okay with it, it's fine by me. I actually heard about an outbreak of meningitis at a college not too far from here where a kid died. I don't want anything to do with meningitis.
I understand. So, I'm hearing a yes? Okay. In addition to the booster shot, we'll get started with the first dose of MenB vaccine today, and we'll set up your appointment to come back for your second dose.
That sounds good.
Okay? All right. I'll send Joseph in to give Josh his shot, and then I'll be back afterwards.
Did you notice in demonstration 1 that the healthcare provider made a presumptive recommendation for the men ACWY vaccination and used a shared clinical decision-making recommendation for the men B? This is because for routine, catch-up, and risk-based recommendations, the default decision is to vaccinate the individual based on age group or conditions that place the patient at risk for infection, unless contraindicated. In shared clinical decision-making, there is no default recommendation. The decision about whether or not to vaccinate may be informed by the best available evidence of who may benefit from vaccination, the individual's characteristics, values, and preferences, the healthcare provider's clinical discretion, and the characteristics of the vaccine being considered. We see that the parent in this video is accepting overall, but does have a few questions because she is not familiar with the vaccine. Her questions about the vaccine being new and its potential side effects are common ones among parents. These questions do not indicate hesitancy as much as they suggest a lack of information necessary to make an informed decision. Did you notice that the provider answered the parent's questions in a confident, concise, and consistent manner, and without bringing in any additional information that might cause or increase this parent's hesitancy? In the next demonstration, Josh, who is 16 years old, and his mother, Mrs. Mitchell, present for a well visit. This time, Mrs. Mitchell is okay with the booster dose of Men ACWY, but hesitates to commit to the Men B vaccine. Watch as the healthcare provider recommends the 2 meningitis vaccinations to this teen and mom according to current CDC guidelines. You'll see how she also uses motivational interviewing skills in support of collaboration, teen and parent autonomy, and shared clinical decision-making.
Hi, Josh, Mrs. Mitchell. Nice to see you again.
Hey?
Good to see you too.
So, Josh, how are things going with the college search?
It's going all right, I guess. Mom and I are going to visit a bunch of colleges in the next few months, and it looks like I could get a scholarship for wrestling to at least one of them.
We haven't made any decisions yet. It's still early, but it's nice to know Josh will have some options.
Well, I'm really happy for all of you. It's great to have options and to see all of your hard work paying off, Josh.
I guess. I'll just be happy when the year's over.
You know, I get that. Today we're scheduled for a well visit. Let's start with talking about vaccines. We'll give Josh the booster dose of the meningitis vaccine that covers 4 types of the bacteria that causes meningitis. He received the first dose of this vaccine when he was 11. There's also another type of meningitis vaccine for meningococcal B that I'd like to discuss with you.
We expected the meningitis booster shot today, and we're okay with that, but I don't want Josh to get the meningitis B vaccine today, too. I don't think he needs that one now, so let's hold off.
So you're leaning towards holding off on the MenB today, and that is perfectly okay. This is your decision. I just want to be sure you have the information you need to make an informed decision. I'm curious, though, what have you heard about the vaccine?
I know that this disease is rare. Does he really need the vaccine?
Is it okay if I share with both of you some information about the MenB vaccine and why I recommend it for you, Josh?
Sure.
You already know that meningitis is a serious brain infection that, although uncommon, can progress rapidly and lead to death or other serious long-term health problems. The vaccine that Josh has already received protects against 4 types of the meningitis bacteria. The MenB vaccine, which requires 2 doses, protects against an additional type of the meningitis bacteria that is actually the cause of most meningitis outbreaks in the U.S. today. Most cases occur between the ages of 16 and 23, and while the incidence is low, college students are at an increased risk for MenB disease. What questions, if any, do you have about the Men B vaccine?
Is this a new vaccine? Are there any side effects?
Great questions. Actually, vaccine for Men B have been used in the U.S. since 2014. And as with most vaccines, the most common side effects don't last very long and are typically mild. They include soreness or swelling where the shot is given, tiredness, headaches, muscle pains. More than half of the adolescents will experience one or more of these, and less often, some people have nausea. These symptoms usually go away in a few days.
Those sound like some serious side effects, Dr. Jackson. Josh has a wrestling tournament in 2 days. This is an important tournament. He's got to be at his best. I don't think we can risk that.
You're mainly concerned about the side effects of the shot and Josh's ability to compete?
Yes.
Well, I might not get any of those side effects, Mom.
True, but you could also get all of the side effects and then you wouldn't be able to participate in the tournament.
Yeah, you're right. I wouldn't want that to happen.
Of course, we wouldn't want that to happen. And at the same time, the vaccine is the best way to prevent a very serious disease. Having said that, I want us all to do what is in the best interest for Josh. What other questions, if any, do you have for me?
Well, is it safe to get both vaccines on the same day?
It is safe to get both at the same time. He would get one shot in each arm, as recommended. Perhaps you need some time to think about it?
We just weren't expecting a new vaccine today, and I do need some time to think about it.
Well, I'll give you an information sheet on the Men B vaccine, and we can talk about it the next time you come in.
Dr. Jackson, I do have one more question. Is this a vaccine you would give to your child?
Absolutely, yes. My children were vaccinated for Men B around Josh's age.
Well, that is reassuring. We'll look at the information and make a decision before we see you again. Josh?
I'm good with that.
Great. Josh and I will continue with the examination, and then Joseph will come in to give Josh a shot when we're done.
All right, I'll be outside, Josh.
Here, once again, we saw the healthcare provider start with the presumptive recommendation for men ACWI and the use of a more participatory shared clinical decision-making approach for Men B. However, this time, the parent is hesitant to make a decision about the Men B vaccine. Because the healthcare provider's goal is to facilitate a process of collaborative clinical decision-making about Men B, she uses MI skills to demonstrate a desire to elicit and understand the parent's concerns. She also demonstrates the spirit of MI by sharing information with permission, seeking collaboration in the clinical decision-making process, and making 2 strong autonomy support statements at the beginning and the end of the conversation. Finally, the healthcare provider uses core MI skills, such as open-ended questions and reflective listening. Did you notice the common questions that were posed by the parent? She asked,
Is this a new vaccine? Are there any side effects? Does he really need the vaccine?
For each question, the healthcare provider gave a confident, concise, and consistent answer. Just as in the first demonstration, the healthcare provider did not include any additional information beyond what was asked that might have increased the parent's hesitancy. In this demonstration, we will see now 17-year-old Josh and his mother, Mrs. Mitchell, return for a follow-up visit to get the Men B vaccine.
Hello, Josh. I can't wait to hear what college you've chosen.
Well, I've decided on one, and I want to stay local, so I'm going to the state university.
He got a good scholarship. And even though he'll be living in the dorm freshman year, he'll be nearby, so we'll still get to see him.
You know, that's wonderful. I'm really excited for you. So, Mrs. Mitchell, the last time you and Josh were in, we talked about the Men B vaccine. I'm wondering if you had a chance to read the information I shared and what your thoughts are about getting the vaccine today.
Yes, we reviewed the vaccine information that you gave us, and we did some research on our own. We know that Men B is rare, but the reactions I was concerned about pale in comparison to the disease. We're going to get the vaccine today.
I'm glad that you've come to a decision that works for you and Josh. Was there anything else you needed today or that you wanted to discuss?
I don't think so. Josh?
I'm good.
Okay. I'll send Joseph in to give Josh his shot, And we'll also schedule Josh for the second dose of the Men-B vaccine, okay?
This brief demonstration illustrates the power of shared decision-making. With the needed information to make an informed decision and without unnecessary pressure from the healthcare provider, this parent and adolescent came to the decision to vaccinate on their own. In this final scenario, 18-year-old Josh, who does not have plans for college at this time, presents for a well visit without his mother, Mrs. Mitchell. Watch as the healthcare provider uses a participatory shared decision-making approach to recommend the Men-B vaccine and how she actively engages Josh in the process.
Hi, Josh. Good to see you again. How's everything going?
Good.
So you're out of school now. Congratulations. What are your plans for the future?
Well, I'm not sure. I think I'm going to take some time off of school to figure out what I want to do next, but I'm working construction with my dad right now.
There are so many options for a talented young man like yourself. I'm glad you're taking the opportunity to explore what you really want.
Thanks. I won't take too long, but I definitely need a break right now.
So, looking at your chart, I see that on your last visit, you and your mom were not ready to get the Men-B vaccine. And we left the door open to talk about it again. So, as I explained then, Men-B vaccine covers an additional type of the meningitis bacteria that wasn't in the booster vaccine you received when you were 16 years old. I'm curious to know, what are your thoughts about the vaccine today?
Well, I know my mom had some concerns about the vaccine, but I think she was mainly concerned because I was getting ready for a state wrestling tournament at the time. But I'm not wrestling right now.
So the side effects are less of a concern for you now?
Yeah, I guess I'm not too worried about that. I do have another question though.
What is that?
Well, I was talking with a friend of mine who got the vaccine, and he said he got it because he was in college. And I figured since I'm not going to college right now, I probably don't need it.
So you're wondering if the Men-B vaccine is even recommended for you?
Yeah, I was curious about that.
Well, it is true that there have been some outbreaks of Men-B in colleges over the past few years. However, college attendance is not the only risk factor for Men-B. Right now, what we do know is that young people like you are at some risk whether they go to college or not. And that it is recommended that everyone 16 to 23 years old consider getting the vaccine.
Really?
Yes. Getting the vaccine is the best way to prevent meningitis B. You have any other questions about the vaccine, Josh?
So, what is it about young people that puts us at a higher risk in the first place?
That is a great question, Josh. It's essentially about exposure. Young people tend to gather in groups and spend more time together in enclosed spaces like bedrooms or dorms. They also tend to share food and drinks. This is true whether or not you're living in a college dorm. While it's rare, the disease does occur most often in your age group.
Okay, let's do it.
You know, I really appreciate your willingness to think this through. I'm glad you made a decision that you feel comfortable with. We'll do the first shot today, and we'll schedule a time for you to come back for your second dose before you leave today.
Sounds good.
Good. I'll send Joseph in to give you your shot, and then I'll be back afterwards.
Notice how the healthcare provider directly engages Josh and demonstrates strong support for his autonomy to make the decision about vaccination. She notes that Josh and his mother were hesitant to get the Men-B vaccine at the previous well visit, but she does not inquire about his mother's thoughts today. She asks Josh directly about his own thoughts and intentions around vaccination. In this demonstration, the question raised by Josh is a common one. Many adolescents are misinformed about the risks of meningitis B, believing that greater risk only applies to young people who attend college. The healthcare provider described the risk for college students and reinforced that there is really no way to predict which healthy young people are at risk. Josh receives this message clearly, as demonstrated in his response, "Okay, let's do it." Notice, too, that the healthcare provider answered only the questions asked and did not bring in any extraneous information that might raise new concerns for Josh. She ends the vaccine conversation with a strong affirmation of Josh's ability to think through the issue and make a decision that is best for him. This video series has demonstrated discussions about adolescent vaccines with families featuring healthcare visits with teens 16 and 18 years old. Through these demonstrations, Unity hopes to empower healthcare providers to make vaccine recommendations in a confident, concise, and consistent manner, engaging both parents and adolescents in the decision-making process. You can learn more about Unity and find helpful resources, tools, and educational materials about adolescent immunization and preventive health care for you and the parents and adolescents you serve at our website, www.unity4teenvax.org.